Good afternoon and welcome to the Health and Government Operations Committee. I'm your chair, Jocelyn Pena-Milnick. We are going to have a briefing followed by bill hearings. So I want to go through some important announcements. Please be mindful that conversations may be picked up by the new closed captioning. And if those of you that do not know, we're very proud in HGO that the closed captioning came out of an experience that we had with a witness last year where we tried to go out of our way to help her, and then we realized this was needed, and leadership was amazing, and they worked on it, and now we have it. We're going to have a briefing today from the Department of Health. What I am going to ask you is that if we encounter any technical or streaming issues, be patient. This is being briefed live on the Maryland General Assembly YouTube channel. And before the briefing, I know, because I got it, that all the members were emailed a copy of the presentation, and I want to thank our staff who are amazing. Andrea, I know you're listening, and she always gives us the documents that we need. For the committee, when we have the briefing, will you be so kind and adhere to our usual committee rules of one question and one answer from the panel, not one question and one answer from each panelist? And please keep your questions brief. You know that you can also, as you do so well, email them or call them as well. Today, the Health and Government Operations Committee will hear a fiscal briefing from the Department of Legislative Services, followed by an overview of the Maryland Department of Health budget. So we're going to begin today with Ms. Tanya Zimmerman, who's the Operating Budget Manager from the Office of Policy Analysis, and then the Department of Legislative Services. Will you please get started? And thank you for being here with us.
Thank you, Chair. So turning to page 1 of the fiscal briefing document.
Is this your first time in HGO?
Yes.
Welcome. Do we have questions for her? Anyone? Yes. Yeah, I'd like to do that too.
So turning to page 1 of the document, this is kind of a summary of the major topics in the budget. Starting with the chart at the top, this presents the change in the budget compared to the prior year. Across all funds, the budget increases by about $790 million, or 1.2%. General funds decrease by about $274 million. A lot of that's driven by some fiscal 2024 costs for which there were insufficient kind of appropriations that are being paid for in fiscal 2025. The governor's spending plan leaves a general fund balance of about $106 million at the end of fiscal 2026. The rainy day fund would end fiscal 2026 with a balance of $2.1 billion, or 8% of general fund revenue. Ongoing spending in the allowance exceeds the ongoing revenue by about $186 million. This is short of the Spending Affordability Committee's goal of eliminating the projected structural deficit in that year. If you turn to the next page, this presents the impact on the general fund of the governor's legislative proposals. Before these actions, the closing balance for fiscal 2026 would have been a shortfall of about $2.9 billion, but with the proposals, it would be the $106 million that I mentioned earlier. Revenues account for about $1.3 billion of these. I'll go into some of these additionally later. Some of the additional ones include some interest earnings from the Strategic Energy Investment Fund. Last year's BRFA authorized the interest from a number of special funds to be directed to the general fund. This was exempted at that time, and this would bring them into that as well. There are also transfers to the general fund from various funds totaling about $634 million. The largest of those relates to the Local Income Tax Reserve Fund, for which there would be a repayment. There are spending reductions totaling about $1 billion. The largest of those relates to not appropriating surplus from fiscal 2024 into the rainy day fund. That's about $119.5 million. The second action crosses both fiscal 25 and 26, about $139 million related to increasing the Medicaid hospital deficit assessment, and then $93 million is related to reducing the state share of the teacher retirements. If you turn to the next page, this presents the structural outlook. The orange bars are the plan based on the administration plan. The blue line was the DLS forecast in December. As you can see in this chart, the DLS forecast in December had about a $2.5 billion deficit shortfall and a structural shortfall in fiscal 2026, growing to over $6 billion in 2030. The governor's spending plan reduces that deficit to $186 million in fiscal 2026, but still grows pretty substantially beginning in 2028 and would be over $3.4 billion in fiscal 2030. If you turn to page 4, this shows kind of how the governor erased the projected deficit, and that is a combination of spending reductions, which I'll detail more in a minute, revenues of about $1.3 billion, as well as some transfers. The next chart on page 5 presents kind of an explanation of how the spending reductions were occurred. About $1 billion of those are related to the actions that are in the Budget Reconciliation and Financing Act, or the BRFA, and there are also some fund swaps as well. Kind of the 3 policy areas of change that led to the reduction are in the child care subsidies due to capping enrollment. There are reductions in the public higher education below what was expected, and then the developmental disabilities. There are some cost containment actions both in fiscal 2025 and 2026 that led to a lower estimated spending. There are areas that increased above what DLS had forecasted, including in the area of Medicaid, as well as a few initiatives. Some of the initiatives are detailed on the next page, on page 6. In total, the budget plan includes about $187 million of funding for enhancements that DLS had not anticipated. More than 2/3 is related to stimulating economic growth, and there's about $55 million of that is capital-related expenses. Turning to the next page, this summarizes some of the proposed income tax changes. This particular page is focused on the personal income tax reform, which is the largest of the revenue proposals that impact the general fund. The proposed changes include actions to add a new surcharge for 4 years on the capital gains for people with incomes over $350,000. And there are also changes to the tax brackets, which include consolidating the lowest 4 tax brackets and adding 2 tax brackets at the higher income levels. There are other proposed changes, including increasing the maximum standard deduction, as well as eliminating the current phase-in of the standard deduction so that everybody at all income levels qualifies for the same standard deduction. It eliminates the option to itemize deductions, and also modifies the child tax credit, so instead of a kind of cliff at $15,000, it would phase out over time, over the income up to about $25,000. Page 8 presents the kind of 5-year impact of both the general fund as well as some other revenue actions included in the BRFA. So the items that are shown with the black text are those that impact the general fund revenue. The items in blue provide revenue to the blueprint fund. In green, those are the ones for that support MDOT. And then the red are kind of other special funds. So the personal income tax reform is expected to raise about $692 million in revenue in fiscal 2026. And then the capital gains surcharge provides about another $128 million. There are two actions related to kind of gaming related. One increases the sports wagering tax, and the other is the table game tax. In the first 2 years of those tax rate increases, they would go to the general fund, and after that, they would support the Blueprint Fund. There are also some changes proposed to the corporate income tax, which begin in fiscal 2028. It reduces the corporate income tax rate from 8.25% to 7.99% over 2 years, but also includes a proposal related to combined reporting. In the green, the supporting MDOT, the largest action is adding a retail delivery fee per 75 cents per order for those orders that are subject to the sales tax, and limiting the trade-in allowance to purchases of $15,000 or less are the two largest. In red, the first line, this has no net impact on revenue, but is a bit of a change in the unemployment insurance. It would add an administrative fee of 0.015%. Which would be offset by a reduction in the regular unemployment insurance taxes, so there would be no net change in the tax rate that was paid. Turning to the next page, this presents some information on kind of other key features. The K-12 education funding increases by about $551 million. The proposed budget improves the health of the Blueprint Fund by permanently reducing the mandate for the consortium on coordinated community supports by about $90 million. And then there are other actions largely included in separate legislation that are with reductions that are contingent in the budget related to delaying the phase-in of the teacher collaborative time, and then some that are also relate to the expanding some programs related to the Grow Your Own Educators Grant Program and the Academic Excellence Fund. There is a pause in the Concentration of Poverty Program for 2 years that would begin in fiscal 2027, so it does not have an impact on the fiscal 2026 budget. The changes delay the need for general fund support for the Blueprint until fiscal 2028 and reduce the amount of general fund support needed in that year. The rates for most healthcare providers, including those serving Medicaid enrollees, would increase by 1%. And there are, as I mentioned, cost containment actions related to the Developmental Disabilities Administration of about $97 million in fiscal 2025 and $235 million in fiscal 2026. As I mentioned before, there is an assumption, or the Child Care Scholarship Program funding assumes that there is a cap on enrollment that would begin this year or in fiscal 2026. There is a $116.6 million deficiency appropriation to support fiscal 2025 costs. The base funding for the university system in Maryland declines by about $105 million, but there are funds provided to cover fiscal 2026 salary enhancements. The budget plan shifts about $144 million of cost to local governments by increasing the local share of the cost of property valuations, requiring locals to pay a larger share of teacher retirement costs and the contribution for non-public placements. The next kind of and last page that I'll cover in the document are related to the potential legislative issues. The first is related to the long-term sustainability of the budget. As I mentioned, the governor's proposal does not meet the spending affordability goal for structural balance, so additional ongoing spending reductions or revenue enhancements are needed to resolve the structural gap. The funding implementation of the Blueprint for Maryland's future remains the kind of largest out-year budget challenge, and it accounts for 3/4 of the structural shortfall for fiscal 2030. There's a potential federal fund policy changes that create substantial uncertainty, cuts to employment or aid to the state would hurt the economy and the budget. The revenue estimates do not make assumptions about this, but just for context, about 8% of Maryland taxpayers received a federal W-2 in tax year 2021. There's increased revenue volatility as a result of the governor's proposals in the Budget Reconciliation and Financing Act, while at the same time the income tax changes increase the state's reliance on the volatile revenues like capital gains. And the final item to bring to your attention on the potential legislative issues is related to the Child Victims Act of 2023, which allows a survivor of alleged sexual abuse to file a civil lawsuit against the state with no statute of limitations. The state's liability is capped at $890,000 per occurrence, and there's been approximately 3,500 claims that have been identified to date. Given the early stages of the claims, it's difficult to value the state's potential liability. The state is engaged with plaintiffs' counsel on an alternative dispute resolution process. There's no funding in the budget to account for this because the timing and the amount of the settlements is uncertain, but negotiations are advancing, and so funding may need to be identified for this purpose by the end of session. And that concludes my presentation. I'm happy to take any questions.
Nope. I'm going to open it up for questions. I want to thank you for, being in front of us today and presenting this information. First, I see Delegate Woods, followed by Delegate Shalega.
Thank you, Madam Chair. I just was a little baffled by one thing. You said that a key feature was to improve the health of the Blueprint Fund by permanently reducing the mandate for the consortium on coordinated community supports for behavioral health services from $130 million to $40 million. And I'm just a little concerned and baffled by that great reduction in those coordinated community support services. And if you could give me some kind of an understanding of how that is going to benefit the Blueprint.
1 second. You can come back. You can sit next to her.
I was just looking through I was just a PowerPoint person.
She was like, you're not going to do that.
So the funding for this particular mandate is from the Blueprint Fund. So reducing the mandated funding for that particular program relieves the Blueprint of the requirement for that $90 million. The $40 million is the level of funding that the program received in fiscal 2025. You will be hearing after I speak from an overview of the MDH budget, and our analysts can probably talk a little bit more about the impact of that on the program.
I definitely would like to hear more about that great reduction with the increased needs for behavioral health services. Thank you. Thank you, Madam Chair.
My pleasure. I have Delegate Shalega, followed by Delegate Alston, then Delegate Taveras, then Delegate Morgan.
Thanks, Madam Chair. Thanks for being here. I just have a few quick clarifications. On page 1, you said the general funding declines due to cost containment and fiscal 2025 budget, including $268 million cost. Does that mean that we spent $268 million more than we had in the budget last year?
On net. So there are deficiency appropriations as well as some areas where they're expecting the fiscal 2024 spending was higher than was expected, and so will be reduced, but on net in general funds.
Yeah, we started in the hole. Then on the next page 2, the increase in Medicaid, is that a hospital tax of $138 million?
The actual increase in the hospital deficit assessment is actually larger than that. The general fund savings are lower because Medicaid would pay that cost as well. But yes, it does increase the deficit assessment that's paid by the hospitals.
Which is just a tax. I mean, you can call it a deficit assessment, but same thing, right? I mean, you send them a bill and they send you money.
Yeah,
Okay, thank you. Okay. Regular people call that a tax.
I'm not regular.
So page 6 says, called Budget Includes Enhancements. Are those all new programs?
They're not all new. Some are expansions of existing programs. So the Enough Act, that was legislation that was passed last year. There's the EARN program has received funding for several years in the Department of Labor. West North Avenue has also received funding for grants. So they're not all new. It is a mix of new and expanding current programs.
And my last question is about Blueprint on page 9. It says the funds will allow teachers to gradually reduce classroom time from 80% to 60%. So the Blueprint is going to reduce the amount of time our teachers spend in the classroom eventually to 60%, or is it going to be lower than that?
I would have to look into that specifically. The additional funding for the per pupil amount was to kind of allow for that that particular change, but I would have to look into whether there was kind of anything further beyond that.
But on its face, the Blueprint is going to take teachers out of the classroom 60% of the time.
They would be in the classroom 60% of the time.
Okay, so they would be out of the classroom 40% of the time. I mean, that's 100%, so.
If you know the answer, if you don't, you can say, I don't know, it's okay.
Yeah, I can get back to you on the specifics.
Thank you.
Yeah. Because she's presenting on the budget, and they don't know all the details of these programs. But you can get back to us, okay? Thank you. There are a lot of questions, but don't worry. We're going to get through them, okay? And they're nice people here. So we have next Delegate Olston, followed by Delegate Taveras. Then I have Morgan, and then I had Hutchinson and Hill. All right.
Thank you, Madam Chair. My pleasure. So I have a couple of questions. First, the structural deficit continues to increase, and I'm just wondering what is the plan to eliminate it, because it's not getting smaller by year, it's getting bigger every year.
Yeah, so the governor's proposal has some actions to reduce it, but that is one of the challenges for the out years, is how that will be reduced going forward.
Has there been any analysis as to how the Blueprint is adding to the structural deficit and what we can do to start decreasing it, and what other programs we may need to look at spending less on?
In terms of the kind of specific, like what programs could or could not be changed, but the reason, like beginning in fiscal 2028, one of the reasons for the increase is the kind of fund balance. The Blueprint revenues no longer, and plus fund balance, no longer cover each individual year's costs. And so those costs need to be borne by the general fund. If you turn to, there's a chart in the document on page 12, which shows kind of by year. The blue bars are kind of the ongoing revenues. And they are, kind of relatively stable, kind of steadily increased. This is based on what the governor's proposals are in terms of the revenue, at about 1.7 billion. The green bars are the balance. So there's been use of balance to help pay for the cost through fiscal 2028, but in beginning of fiscal 2028, the kind of fund balance is exhausted and general funds are needed based on current law. So there would be options based on revenue changes or spending changes to reduce that impact.
Okay. I would like for your office to schedule a one-on-one, because I have a lot of questions and I don't want to do it in this context. But I think the final thing, there was a chart, and I'm just wondering, was it only healthcare programs because we're the health committee, or were there other programs on chart 5? Because it looked like all of the programs being cut were. health related?
These, no, so this is kind of the overall plan for like where the spending, where the savings were. This is the same document that we have used for across all of the committees. So this wasn't changed. There are, particularly on the Budget Reconciliation and Financing Act provisions, beginning on page 23 of the document, provides a lot more detail about the different actions that were taken, because it's just shown on that one chart as $1 billion, but there are actions kind of across that. And then later, kind of in the appendices, there's kind of additional detail on the spending changes across all areas of the government, including local aid as well as kind of state agency changes that will provide more information.
I know that I'm being lenient today. Did you notice that? I'm being extra lenient with the questions, allowing them. So I'm going to allow it, okay? Go ahead.
Thank you so much, Madam Chair. I won't. We have some tough financial times, hard decisions to make. I was wondering if you all had any estimates on how much we would raise by eliminating itemized deductions, because that's going to be a big hit for working people.
I think we're still finalizing those. The governor's plan just had kind of provided one number across all of them, so we're still working on the particular impacts of each provision. There will be a fiscal note on the BRFA that we will prepare for the hearing, that the department will prepare for the hearings.
Okay, thank you. Thank you, Madam
Welcome.
Chair.
You're welcome. I have next, it was Taveras, but she just stepped out for a second. Let's go to Morgan.
Thank you, Madam Chair. And I appreciate you being so lenient. Multiple questions. I actually only have 2 questions. So first on page, I believe, 1, it talks about year-over-year growth in the budget. So last year, the budget is basically a forward-looking spending plan. That's why we call it the FY26 fund, budget. So last year, the budget submitted by the governor was $63 billion and I think 200 million or something like that. This year's budget's 67 million, I believe, right? Is that what it says on page 1? It's on a different page.
67 billion.
Yeah, so where's this $2 billion in cuts that we keep hearing about on talking points and news shows and things like that?
So the 67 billion is across all fund sources. So the general fund spending declines by 274 million compared to the prior year. There are $1 billion across both fiscal 2025 and 2026 related to the Budget Reconciliation and Financing Act. There are other spending reductions that are included as part of like a deficiency appropriation for the current year. Those are reflected already in the numbers that we're showing for 2025. So it would account for those. So what you see as 2025 is not just the numbers that were passed kind of last session. It also accounts for some of the proposed changes through to the current spending plan.
Okay, so I'm not going crazy. The state is spending more money than it did in the year prior, correct?
Across all funds.
Sectors.
Across
Okay,
all
got it.
funds, the general funds do decrease.
On page 14 of your handout here.
That's a third, but it's okay.
Oh, well, no, that wasn't,
It's a 2, but okay, you can have a third, go ahead.
that was more like a, yeah, that was like a 1.5.
The lawyer.
Need to plan ahead better. Thank you, Madam Chair. On page 14 of your document, it talks about growth comparing Maryland to the United States growth, but it also compares us to Virginia. Why is Virginia doing so much better than we are?
I would have to get back to you on that.
Okay. Thank you. Thank you, Madam Chair.
And if I can have a follow-up to the great delegate, and this will be your 4th. Across the board, he asked a question that the state was spending more, right? Can you tell us why, if you know?
So
Where do they go up? Will you give us some specifics?
it is like across all funds. So some of the areas of like special fund spending growth that occurs, which is the area where there is, special funds are the area where there's growth in the budget. So that includes funding for the blueprint cost of about $543 million. There's also about $343 million related to transportation, and about $90 million for funds from the alternative compliance payments that are going into the dedicated purpose account to be used for the state's climate reduction plan. That special fund number also includes higher education funds, kind of from their own source revenue, tuition and fees and things like that, which also contribute to that number.
So this is across the state for all 24 jurisdictions that this money is used?
Yep.
Okay. I have next Hutchinson, followed by Hill.
Thank you, Madam Chair. And I only have one question, but it was a question I was going to hold until the next briefing from MDH. But since she ran away, I wasn't sure if I should ask it now.
Oh, no, the ND, in Heart Defense, the NDH panel is a different panel.
Okay.
And they're gonna come. She was here last night, and she did a superb job.
If you think this should wait, but,
We can wait for NDH to do it.
well, next to getting constituent inquiries about rising energy bills, the second one has been the $200 million reduction in developmental disabilities.
I think that is, I don't know if you can do.
Should I wait until MDH comes?
Yeah, wait for NDH.
Fair enough. Yep.
Yeah, thank you, and thank you for,
Being so kind and flexible. Delegate Hill.
Madam Chair, and thank you for the presentation. I just wanted to ask on page 8, if you could flesh out a little bit more the lowering of the estate tax exemption from $5 million to $2 million, and the elimination of the inheritance tax, both contextually where we are, and whether that estate tax would include life insurance, irrevocable trust, LLC and corporate profits, small business profits, farms, what's excluded, what does that, because it doesn't seem like it takes a lot with the economy today and the high cost of housing for average middle class and lower middle class Marylanders to get to a $2 million value on their estate.
I would have to get back to you on the specifics. I will admit that I am not an expert on taxes.
Okay. And it's zeroed out simply because it requires legislative action, and that's why you all zeroed it out?
No, our understanding is the change to eliminate the inheritance tax would, and the lowering of the estate tax exemption, the revenue impacts of those offset each other. So that's why there's no dollar impact shown.
May I ask an unrelated question? Sure. Thank you. On page 9, there's a note at the end that talks about cost containment measures without specific detail in terms of the Safe Development of Disabilities Administration, $97 million of general funds, cost containment measures to raise the Medicaid hospital deficit assessment. Do you have any details on what those cost containment measures might be looking like?
Yeah, so there are, you will be hearing about the MDH overview in just a minute. There's a couple different types of actions proposed. They do a variety of different things. Some of them kind of impact the provider, the reimbursement for certain providers. It also includes some changes proposed to self-directed services, as well as eliminating the low-intensity supports program. Both of those are in the Budget Reconciliation and Financing Act. Some of the others do not require legislation and are not included in that, but you will be able to hear a little bit more about that in the next presentation.
All right, thank you. Thank you, Madam Chair.
If you see me, I was throwing someone a kiss. One of my biggest supporters. Joan, you want to say hello, Joan Anderson? Right here. And she surprised me today with a visit, and it takes a lot for her to come here, all the way from Laurel. How old are you, Joan? How old?
Y'all wanna say I'm 92?
All right, well, the committee welcomes you, Joan, okay? We're in the middle of a briefing, but I wanted to say hello to you, and I'll take a minute and I'll come back.
And I'm leaving, I got something for you right quick.
Oh, that is so sweet, Joan. Can you take over for a minute? That is so sweet. That is so nice.
This is just one thing.
Oh, you're so sweet.
I think
I'll come back here.
we needed
Oh, that is so sweet. Thank you, look at this.
And let's see.
Oh, you're so sweet, come over. No, she's gonna take over, go ahead, go ahead.
So I have Delegate Hill next. Oh, you went? Okay. Are there any other questions? Oh, I'm sorry, Delegate Bandari.
Thank you, Madam Vice Chair. Given our state projected budget deficit, can you elaborate as much as you can on the specific cost driver within Medicaid, childcare subsidies, and correctional health care that have contributed to the shortfall, I guess? And additionally, what strategies is the Department of Legislative Service considering to address these rising expenditure while maintaining the essential services?
So for the inmate medical, there was a new contract awarded that has a higher cost. So that's driven those costs. The childcare, there has been kind of rising number of participants, and there have been some other kind of changes about the program over the last few years that have contributed to the higher costs. Medicaid, again, you'll hear a little bit more about this in the next briefing as well, but enrollment remains high, is a significant factor.
Thank you.
Any other questions? Seeing none, thank you. Oh, how did that happen? Delegate Johnson, thank you.
Thank you, Madam Chair, and thank you for coming to help explain some of this. On page 7, some of the proposed income tax changes, I notice eliminating the standard or the current phase-in of all standard deductions on all households for $5,600 to $11,002 regardless of income. And the modifying the child tax credit to phase out benefits gradually. Under the current law, lose the $500 per child benefit once the income tax exceeds $15,000. If you could just kind of explain what the thought process, because those are pretty low income households.
The current phase-in provides of the standard deduction provides a lower standard deduction for people with certain low incomes. This now makes it the same standard deduction available to all, and it's a higher deduction overall because the standard deduction would be raised under this proposal. So this, the eliminating the phase-in has the effect of kind of reducing taxable income for those who would have previously received only a smaller level of standard deduction because they didn't qualify for the full standard deduction based on current law. The child tax credit, what it's doing, so under current law, if you made if you had $15,001, you wouldn't qualify for any child tax credit. This allows that to gradually phase down. It's like $50 per every $1,000 of income above $15,000. So it kind of extends the incomes to which it applies. I think it fully phases out, I believe, at like $25,000 or $24,999 or whatever. So it gradually phases it out. compared to the current law where it is completely, you don't get anything after 15,000.
All right, thank you. Thank you, Madam Chair.
Delegate Johnson. Delegate Bagno? Same question. Okay. Now, I'm going to take one more sweep. And I do not see any more questions. So thank you very much for being here today. And I suspect you'll be hearing from members of the committee who may have additional questions. I'm sure that Delegate Morgan isn't finished yet. So now we're going to hear about the healthcare budget overview. This is Natalie Camoro, Ann Braun, and Victoria Martinez. If you would all come up.
Give me 1 second. I just want to say thank you very much, Ms. Zimmerman, for coming. Thank you for being patient as we ask the questions. And we really appreciate you, and you're welcome here anytime, okay? Thank you. Thank you so much. That was so sweet. She came all the way from Laurel with a walker to come and say hi. Wow. How are you today?
Great, thank you for having us.
You're welcome anytime. And let us know when you're ready and you can get started. Who would like to get started?
I'll go ahead and start.
Okay.
Can't tell if this is.
Yeah, it's gonna stop in a minute. It's a little temperamental. Hold on a minute, don't touch it.
Okay.
Hold on a minute. He's gonna take care of it. It's ready now for you.
Okay, great. Thank you.
You're welcome.
Good afternoon. My name's Naomi Camaro. I'm a budget analyst with DLS. I'll let my two colleagues introduce themselves.
Hi, my name's Ann Braun. I'm here today as the DLS analyst for the Medicaid budget.
Hi, my name is Victoria Martinez. I'm the DLS analyst for Developmental Disabilities Administration, Health Professional Boards and Commissions, and the Office of Healthcare Quality.
So we'll get started. Starting on page 2 of the analysis, we've summarized across the entire department that the fiscal 26 budget decreases by about 1.3% from the fiscal 25 appropriation to $21.5 billion. On page 4 begins a discussion on some of the budget actions that impact the fiscal 25 budget, including several deficiencies which are listed out in one of the appendices. I'll just point out a couple. There is a net increase of $2.25 billion to the fiscal 25 appropriation due to these deficiencies. Notably, at the top of page 5, there's several related to unanticipated spending growth in DDA and Medicaid. So the first one, you can see there's $740.7 million in funds in DDA, $857.3 million in funds across Medicaid and MCHIP, and about $650 million in funds to support traditional and behavioral health Medicaid services. On page 6, there's a summary of some cost containment measures that the Board of Public Works authorized in July of 2024, the largest of which was $12 million reduction in the funding to support local health departments in fiscal 25. Page 7 breaks out the fiscal 26 spending. So again, the total budget across the department is $21.5 billion. And a majority of that funding is allocated to provider reimbursements in BHA, DDA, and in Medicaid. Pages 8 through 10 summarize the major changes in the budget between fiscal 25 and fiscal 26. Again, that decreases by $290 million, which is driven by decreased enrollment and utilization in Medicaid, as well as cost containment measures in Medicaid and DDA. And then I'll also point out that there is a small increase due to a 1% provider rate increase for providers in BHA, DDA, and Medicaid. I'm going to turn it to Ann briefly to describe what's going on page 11.
On page 11, it discusses the contingent reduction. So these were items that Tanya had touched on earlier, so I'll just provide some more context. So these are items that are reductions to the budget that are contingent on passage of certain provisions in the Budget Reconciliation and Financing Act. That's the companion bill to the budget. The first was the $92.5 million in general fund savings under Medicaid, and that's related to the hospital deficit assessment. And so that's an assessment that's paid by hospital users and and then directly by the hospitals, and it provides general fund savings in Medicaid. So I just wanted to highlight that the BRFA includes a provision that would increase that assessment by $50 million in fiscal 25 and $100 million in fiscal 26. And then the second item we pulled out is the $90 million in special funds that would be reduced from the consortium on coordinated community supports. And so that's $90 million in special funds from the Blueprint Fund. The reason that that would provide support for the Blueprint Fund in the future, as Tanya had mentioned, the Blueprint balance is expected right now with these measures to run out in fiscal 28, when general funds would then be needed to support Blueprint initiatives. And so by reducing these $90 million on an ongoing basis, it extends out. That's part of the reason the funds are available until fiscal 28. Other than that, I'll pass it back to Naomi for the others.
Okay, turning to page 13. Begins a discussion on personnel in the department. So the fiscal 26 allowance includes nearly 7,400 employees, again, across the entire department. Exhibit 1 shows the change in the number of authorized personnel in fiscal 25 and fiscal 26. And as you can see, there isn't much change. The department added about 700 new positions in this current fiscal year in fiscal 25. Exhibit 2 on page 14 shows the change, the growth in the number of authorized positions in the department. And the vacancy rate as well during this period has declined. So as of December 2024, the department carries a 14.6% vacancy rate across all agencies. On page 15 through 17, we've discussed some of the activities and measures that the department has taken to improve recruitment and retention. Exhibit 3, which starts on page 15 and goes on to page 16, lists out some of the classification series that received annual salary reviews in fiscal 23 and 24. The department did indicate that in general, these salary adjustments have been pretty effective in improving recruitment and retention compared to fiscal 2022. And then the rest of the discussion in this section includes some other changes that they've made, some other increments and changes to benefits. I'm going to turn it to Anne for our first discussion issue.
Yes. So this section of the analysis is typically where we pull out a few selected fiscal and policy issues. And so the first one I'll cover has to do with home and community-based service waivers under Medicaid. And so I'll highlight just the ones that have current registries or waiting lists, including community options under Medicaid and the model waiver. And then under DDA, they have 3 waivers that are all handled in one waiting list. And then the autism waiver that is administered by MSDE. On page 19, Exhibit 4 shows the recent statuses of the registries and wait lists for these programs. If you look across these, they vary widely in number of individuals on the registries, with the community options waiver having more than 20,000 individuals versus the DDA community services waiting list has just below 4,000 individuals. Community options from fiscal 23 to 24 showed a decrease in their registry by about 13%, as about 3,214 individuals were removed from the registry over that year. The autism waiver also showed a decrease from 23 to 24, as the wait list for that program decreased by about 15%, or about 1,000 individuals taken off that waiting list. Although both those waivers decreased in fiscal 24, they showed different trends in enrollment, as the autism waiver increased their enrollment, but community options waiver enrollment actually decreased in fiscal 24. MDH didn't use all of its budgeted slots for community options, and so the reduction we're seeing in the registry is more a sign of higher rates of individuals not returning applications and then being removed from the registry, rather than individuals being enrolled in the waiver and then receiving services. MDH has described a couple different reasons for not filling all of its community options slots, and those are listed on page 20. So a few of them include limited capacity of the provider network, ineffective methods for pulling people off the waiver registry, and low return rates of applications. Exhibit 5 on page 21 shows MDH's recent outreach efforts for the reaching out to people on the community options registry. And so on the left, you can see that in fiscal '24, MDH sent out just below 600 applications per month. There was 2022 legislation that requires 600 applications to be sent out monthly. And as of December 24, MDH actually surpassed that requirement and now sends out 700 applications each month. Despite the expanded applications being sent out, only 29% or so of them were returned on average each month. And despite this, MDH hasn't been able to actually work, check the status of all these applications, as at the end of each month, approximately 84% were still in a pending status and not processed. So then MDH has indicated persistent staffing shortages as the main factor for those application processing delays. And for example, MDH reported a vacancy rate of 37% in fiscal '24 among the positions that work on this waiver, specifically on application processing and eligibility determination. In June 2024, MDH began using a contractor to help with some of the backlogs in this process, specifically reviewing plans of service. And so they are starting to use a contract to help with this. So page 22 begins a discussion on registry reduction plans. Those were required in legislation, the End the Wait Act. And in February 2023, MDH submitted 5-year plans to reduce these registries by 50%. The Community Options Waiver Plan overestimated new fiscal '24 enrollment, but still has seen decreases in the registry, as I said, due to the expanded outreach efforts and other efforts to improve data sharing to remove deceased individuals and individuals who have moved so that they're not on the registry anymore. One of the ongoing issues that MDH has described to reduce the registries has been limited provider capacity and a shortage of direct support professionals. And so the department described efforts to build capacity, such as rate increases, surveys on workforce challenges, and technical assistance. And then finally, to support the End the Wait activities, I'll just describe some of the funding that had been provided. So $30 million was added to the dedicated purpose account in fiscal '23 to support the autism waiver expansion. But then the uses were expanded through legislation to be able to be used on other Medicaid waivers. Of this funding, $22.7 million has been spent or appropriated, so that leaves about $7.3 million remaining in the dedicated purpose account. Across fiscal '24 and '25, a total of $16 million was budgeted for End the Wait initiatives and also put in the dedicated purpose account. Cost containment actions approved by BPW in July reduced the $10 million of that funding, and the fiscal '26 budget plan proposes to transfer the remaining $6 million from the dedicated purpose account back to the general fund as part of cost containment measures. And so that concludes that issue. I'll pass it to Naomi for the second issue.
So the second issue in this analysis has to do with the overdose crisis in Maryland. According to the CDC, more than 22,000 individuals died of overdoses in Maryland between fiscal 2015 and 2024. And while there have been decreases in the number of deaths, both nationwide and in Maryland between fiscal 23 and 24, the total number still remains well above the fiscal 2015 amounts. Exhibit 6 shows the year-over-year number of deaths year-over-year, both in Maryland and the United States by overdose. And you can see that Maryland kind of follows a similar trend to that of the US average. Page 25 and 26 discusses some of the disparities that exist between different groups of people in terms of the death rate by overdose. Exhibit 7 shows the changes in the rate of fatalities between calendar 22 and 23, broken out by gender, age, and race. So the group that saw the greatest increase in the fatality rate during this period were Black males ages 55 and over, and then aggregating for all ages, Hispanic males saw the largest increase in the death rate. Exhibit 8 on page 26 breaks out the overdose fatality rate and the number of fatalities by local jurisdiction in Maryland. So you can see that Baltimore City had the highest number of deaths as well as the highest fatality rate. But there are several other jurisdictions with smaller populations that exceeded the average fatality rate of Maryland as well. On page 27 begins a discussion of the funding that the Department of Health is using to address the opioid crisis. So I'll start by summarizing some of the federal funds. Like other states, Maryland receives money from the Substance Abuse and Mental Health Services Administration. Page 28 shows the grants that we receive from the federal government. The largest is the state opioid response grant, which is awarded every 2 years and is distributed to local jurisdictions for opioid abatement programs. Maryland also receives money for the substance abuse block grants, which are also distributed to local jurisdictions, but the uses for that are a little more broad. They can be used on prevention, treatment, and education. This chart also shows the supplemental funding that the state received due to COVID stimulus funds. BHA has also invested quite a bit of general funds in recent years to address this crisis as well as other behavioral health needs of the state. Those are the behavioral health investments. So in fiscal 25, the legislative appropriation included nearly $90 million for that purpose. They are planning to revert $30 million of that. And then the fiscal 26 allowance includes $73 million for this purpose. And again, this covers an array of services, majority of the funding going toward crisis response, mobile crisis, and crisis stabilization. The next part of the discussion covers the opioid restitution fund. So as you all know, Maryland receives settlement awards from the various opioid litigation that it's been a part of in recent years. And the money that is directed toward the state goes to the opioid restitution fund for distribution. And then some of the money goes directly to the local subdivisions per the different settlement agreements. On page 30, there's a chart that shows the amount of money that has come into Maryland since fiscal 2022, as well as the amount projected through fiscal 2038. Again, both directly to local subdivisions and the amount going into the ORF. The ORF, most of this funding is being expended through block grants to local jurisdictions and competitive grant programs to local governments and to community-based organizations. Some of the funding is to be used at the discretion of the Secretary of Health. The department to date has used some funding on data collection and analysis efforts, but most of the funding is going toward grants. I'm going to pass it back to Anne for our last issue.
So the third issue that begins on page 31 has to do with the Cigarette Restitution Fund. Exhibit 11 on the next page shows CRF revenues across 3 years. It shows that it is expected to gradually decline by more than 8%. And this is due to consistent trends of less tobacco use in Maryland. So there is an expectation that revenues would decrease over time. If you turn to Exhibit 12 on page 33, you'll see that fiscal 24 CRF revenues were $25 million less than expected. And in fiscal 25, the projected revenues also are expected to come in about $26 million less than budgeted. The biggest changes are due to lower inflation than expected and a larger negative adjustment that's done for tobacco volume being sold. And so moving to a discussion on CRF spending. Exhibit 13 on page 34 outlines the CRF uses from fiscal 24 to the allowance. To account for the shortfall in CRF revenues in fiscal 24, the amount for Medicaid was reduced by $25 million and backfilled with general funds. To cover the shortfall in fiscal 25, the budget plan proposes deficiencies that would withdraw a total of $27 million from substance abuse services, breast and cervical cancer diagnosis and treatment services, and Medicaid. But the deficiency also backfills all of that funding with general funds. In fiscal 26, you can see that some of that CRF support for those uses does come back and is being restored in fiscal 26. The fiscal 26 allowance also includes 2 cost containment measures that are contingent on the Budget Reconciliation and Financing Act. So these are described on page 35. The first is that $13 million is reduced from the statewide academic health centers at UMS and Johns Hopkins. That's contingent on a provision in the BRFA that eliminates the mandate for the cancer research grants. And since fiscal 25 provided slightly over that mandated level, it provided $15 million. That's why it looks like a reduction of $15 million coming into fiscal 26. But the action would reduce the $13 million mandate. There's also $250,000 that is reduced in fiscal '26 for the Tri-County Council for Southern Maryland. That funding would support the Southern Maryland Agricultural Development Commission. The BRFA includes a provision that reduces the fiscal '26 mandate from $1 million to $750,000, and then it phases the mandate out entirely through fiscal '28. CRF uses are restricted in statute, and so one of the requirements is that 50% of budgeted spending support certain programs and uses. And so those are listed on page 33. But considering the contingent reductions, DLS identified that the fiscal '26 allowance funds these uses at only about 43%. And so MDH and the Department of Budget and Management have plan to propose a BRFA amendment to waive this requirement in fiscal '26 only to align with the budget. The next section discusses ongoing litigation between the state and participating tobacco manufacturers. If participating manufacturers can prove that certain conditions were met, like showing a market share loss due to the master settlement agreement, or that states were not diligently enforcing their statutes, then their annual payments may be reduced. Each year, an adjustment is made to put some of the master settlement agreement payment into escrow pending the arbitration. And so there's 2021 legislation that requires payments received as a result from this litigation to be placed in a separate CRF account, and that the funds replace general fund support for HBCU settlement payments. For sales year 2005 through 2007, an arbitration panel decided in Maryland's favor that it did diligently enforce its statute, and so approximately $25 million is expected to be recovered by the state. However, we note in this analysis that the budget plan doesn't currently recognize this $25 million that's expected. And so you'll see there's bold print in the analysis where DLS makes a recommendation. So that's for the budget committees to consider recognizing these funds under the Medicaid budget. So that concludes that issue, and there are appendices in this analysis that provide additional budget and personnel data, but otherwise that concludes our presentation, and we're happy to answer any questions.
Open it up for questions now, okay? I see Delegate Hutchinson, followed by Johnson, then Delegate Woods, Collison. Delegate Hutchinson.
Thank you, Madam Chair. So you had time, I guess, to prepare for my question since I asked it earlier. But I am still struggling, and I don't understand the $200 million cut in developmental disabilities. My constituents don't understand it. Are we really cutting $200 million? How much did we spend last year, and what's the budget for this year? And what type of services are being cut? It just seems like a big amount for a program to be cut.
Yeah, so the overall budget decreases by $190 million in fiscal 2026. So the
Will you be
majority.
so kind and put the microphone
Oh,
closer
yeah.
to you?
Yeah.
Delegate White Holland really requests that.
Oh, yeah. So the overall DDA budget decreases by $190 million in fiscal 2026. So the majority of this is due to a variety of cost containment actions that were introduced in fiscal 2025 and continue into fiscal 2026. So there were about 9 total separate cost containment actions that were introduced in fiscal 2025, so most of these are ongoing, and then the cost savings become annualized for fiscal 2026. So I could provide this list of all of the different cost containment actions. The biggest one is a modification of reasonable and customary wages, which reduces, aligns the rates for providers to be more aligned with the Bureau of Labor Statistics rates. And then there's also a couple other actions. So there's a geographical differential elimination. There's a policy change for dedicated hours utilization. This item is only in 2026, not in 2025, is a cap on individual and family-directed goods and services for self-directed service participants. The next one is a cost containment action for directing transitioning youth into the traditional model. There's a wage exception process elimination, state-only funded services reduction, an elimination of the low-intensity support services program. And then there's one other cost containment action that's just a fund swap for the waiting list equity fund. So those are all of the cost containment actions. They total a decrease of 160 million in fiscal 2025, and they total a decrease of 457 million in fiscal 2026. So I know that was.
Second one?
No, I know that you had a meeting with them that was difficult, and I probably maybe would like to talk to you offline or so, but I'm getting a lot of calls and questions about how this is going to affect their services. And
So that you know, and the rest of the committee, the chair of appropriations has been really very kind and has actually sought our feedback regarding some of these cuts. And we have been, a small group of us have been meeting with Chair Chetty and have met with a lot of the families. And we have asked them to give us some suggestions, and they have, and I have forwarded those to the Appropriations Committee to try to see if some of those can be restored, right? So that's where we are at the moment.
thank you very much.
My pleasure.
Good to hear that.
My pleasure. And I had, and thank you for being patient as we ask you the questions. We have next Delegate Johnson, followed by Woods.
Thank you, Madam Chair, and thank you for coming to help us out understand this today. My question is on page 21 and 22, the monthly community option waiver. You said you increase and are sending out 700 applications per month. But as I'm looking at this, it wouldn't matter if we sent out 5,000 per month. If we're only able to process 24 per month, it seems like a very ineffective program. So I did read that June of 24, they discussed hiring contractors to help process these applications. So since June 24, have we hired any contractors, and are we being any more effective than 24 applications per month?
I will say this has been a process that we've identified over multiple years of the application processing hitting processing delays. And yes, MDH used an existing contractor to start processing the service plans. And so that was one area where it would slow down processing. But yes, over multiple years, DLS has identified that the pending applications at the end of each month remains high, and there have been a lot of staffing shortages that cause, the department to have the delays and the backlog in getting people enrolled in the program. So the department has reported a couple different ways that they're trying to work on that, but yes, I would say that's something we've identified multiple times.
So right now it remains that they're only processing 24 applications per month?
This was in fiscal 24. I don't have updated fiscal 25 data for you as of now. So I'm sorry, I don't have anything more up to date currently, but I could follow up with you on that.
If you could let us know that, I would appreciate it. Thank you. Thank you, Madam Chair.
You're welcome. And if you could just send it to the whole committee, any information that is requested today, that would be wonderful. So we have next Delegate Woods, followed by Collison.
Thank you, Madam Chair. My question is for Ann. I just wanted to follow up. I heard your explanation for the decrease in funding for behavioral supports, and I heard you talk about the time frame, but what I don't understand, I also heard you talk about BRFA having some special funding, but what I don't understand is there any idea of what percentage of funding will cover that great decrease? We're talking about almost 2/3 decrease in funding, and I don't hear, given the increased need for behavioral support services, how we're going to address that need with this decrease in funding, and if in fact there's any information that we could have as to the special funding that BRFA would be providing.
I don't have much more information on, the impacts of this. The consortium had put out funds, I believe it was about $110 million in grants, and that grant term was supposed to end in fiscal '25. And so the fiscal '25 budget is at $40 million, recognizing that there were some delays in getting grants out. But in terms of the impact of the $90 million ongoing reduction, I don't have any further information other than the mandate would be $130 million, and then the BRFA would propose it to be $40 million each year instead.
You have another one?
Thank you, Madam. No.
Okay. Thank you. You're welcome. I have Collison followed by Bagnell.
Thank you, Madam Chair.
My pleasure.
So I'm very familiar with the history of the community-based waiver program. And I am concerned about the lack of utilization of those slots. But at this point in the budget process, I don't see a way forward for us to, up that significantly. However, what I would like to have, and I don't expect you to have this now, but I would love to find out how much money is being spent on nursing home facilities and what the trend has been over the last 5 years. Because a part of the waiver is designed to decrease our costs, our Medicaid costs, by providing services in people's homes than in nursing home facilities. So I'd like to see if there's been, what that trend is over, I don't know, we could do the last 5 years. That'll help me.
Sure thing. Yes, I don't have it today, as you said, but I'm happy to pull that data for you for Medicaid spending on nursing facilities.
Right. Thank you.
Thank you. I have next Delegate Bagnell. Oh, she asked you a question?
Yeah.
Okay, thank you. I have Delegate White Holland followed by Hill.
Thank you, Madam Chair, and
My
thank you
pleasure.
all so much for this focus on the MDH budget. Appreciate that. You highlighted that the Board of Public Works in July of 2024 took some actions related to some cost containment strategies, if you will, that impacted MDH. I'm looking at the $12 million in cuts related to our local health departments. I know a lot of the work that this committee has done in elevating not just the importance of our public health infrastructure, but really supporting what that infrastructure does. And notice that there will be cuts to core public health services. Now, this occurred for the fiscal 2025, but didn't know if you could expound upon what has that impact been, and knowing that in this particular budget outlook, knowing that those reductions will essentially be sustained, could you share what those potential impacts are and could be as we move forward, specifically as it relates to core public health services, or where else in the budget that might be addressed?
Sure. So I can't speak specifically to how each health department is going to think about their budget with a reduction, because everyone's providing slightly different services. I will say that although there was a $12 million reduction in fiscal '25, the department was able to leverage some ARPA funding. So the health departments are also getting $25 million in fiscal '25 on top of their typical general fund allocation that they get for core public health services. So I imagine that will be helpful. The other thing I can say is that the budget for the local health departments is included in the Public Health Administration analysis, which will be heard later this week, and the analysis for that will be online. So that will go into a little bit more detail about the local health departments. They are getting a small increase in fiscal '26, but the way that the health department funding is decided and mandated is set in statute. It's a slightly complicated, so I don't know if I want to get into it here, but yeah, so to answer your question, I don't know exactly how they're going to adjust, but I will say that the cut is being slightly offset just because there was these available federal funds for the current fiscal year.
And if I may, Madam Chair, I think, knowing that, federal dollars are starting to also wither, right? I think the concern is that is a temporary, action being made. And so just trying to see, what type of outlook there could be for future budget out years, recognizing that this is something that just occurred at this moment in time. Where is it also coming from, and where is there flexibilities in the budget to make sure that the public health infrastructure is sustained? And so it's my hope that we can have further discussions about that when that analysis is available.
Yeah, of course.
Okay, thank you.
You're welcome. Delegate Hill.
Thank you, Madam Chair, and thank you for the presentation and putting all this together. Related, unrelated, MDH, 2 years ago, 2022, was found to have $1.4 billion in funds that we were owed by the federal government that we had not asked for. And then at 2023, we were told that all but $244 million was recovered, and there was some back and forth with audits, legislative audits, about how much of that would still come, and whether there was additional money that hadn't been found that was owed. Can you, as part of this picture of what that budget looks like, give us any update? Have we recovered all the funds we're going to recover? Is there still some outstanding funds, and has that been calculated in these numbers at all?
That wasn't included in this analysis, but I can follow up with you and get the exact numbers. They provided an update to DLS, and they also had to provide an update to the Office of Legislative Audits just to discuss where they were at in terms of implementing all of OLA's recommendations. And that included an update on how much money was left to recover and how much had been recovered. I believe a majority of it was recovered, but I can get you the exact numbers.
Thank you.
I don't see any other, oh, you have another one? Go ahead.
Thank you. I'm going to abuse your leniency today. Just the second number that you gave us for the DDA reductions, the over 400 million, is that including the federal match, or is that just our state funding?
The 400 million in cost containment actions is almost all half general funds, and half federal funds.
So it is both. It's the matching funds. And so it's the total loss. I was just looking at where the money came from. Okay, thank you.
And can you, any other questions? I have a follow-up. Can you explain, if you know, how the hospital assessment is made?
It is paid by mostly hospital users, but the hospitals do pay a portion of it directly.
Okay.
Yeah, and then it, by increasing it, it's reducing general fund need in Medicaid, so it's creating state fund savings.
Okay, thank you. Delegate Hutchinson.
Thank you, Madam Chair. Just a clarification on Delegate Collison's question. Are we cutting DDA 200 million or 400 million? 200 from the state, 200 from the Fed?
No, it's about a net of 200 million. So DDA had an increase of about, I think I'll have to check, but I think it was about 900 million increase in community services. So the payments to providers, that was offset by that 456 million in cost containment actions.
Thank you. Thank you, Madam Chair.
My pleasure. Delegate Shalega.
Thank you, Madam Chair. If you could just review that Medicaid hospital tax/assessment for me one more time.
Sorry, so in the BRFA, there's a provision that would propose to increase the deficit assessment by 50 million in fiscal 25 and then 100 million in fiscal 26. And so to recognize that in the budget, there's the general fund reduction for savings from that, and then you would increase special funds that are coming from that assessment on hospitals. And then, so that assessment is paid by hospitals. Most of it is covered by hospital users, and then a portion of it is paid directly by the hospitals.
So that's the part I meant, hospital users. So the hospital puts a fee on the users. Explain how the mechanics of that work.
I will have to get back to you on exactly the details, but yes, there's a portion that the hospitals pay directly, and then there's a portion that gets paid by the users through the rate setting system.
So the users would be commercial payers?
Yes.
Because you can't.
Any payer of hospital services.
Fee on Medicaid users, can you?
It would increase hospital rates, and those are paid by Medicaid as well. And so that's why when you see $100 million in special funds get added to the budget, but the reduction to Medicaid is actually $92.5 million in general funds, state funds, and that's to recognize the fact that Medicaid does also pay hospital rates. And so by doing the assessment, Medicaid would also pay us, more on the hospital rates as well. So that's why it's not an exact equal amount being pulled from general funds.
So a little bit of the Medicaid user fee, which so taxpayer, so the budget is paying the fee and then paying the fee back.
A portion, yeah, you want to account for the fact that Medicaid would also be paying slightly more for hospital services, and so that's what that's doing.
Okay, but most of that fee is coming from commercial payers.
Right, from payers of hospital services,
That are
yes.
not Medicaid or Medicare.
Correct.
Because you couldn't charge Medicare that. You couldn't charge Medicare users that hospital fee, could you?
It goes through the HSCRC rate setting process, I believe, but before,
I'll clarify it. In the state of Maryland, all payers, regardless, Medicaid, Medicare, insurers, right? Hospitals, everyone pays the same fee. We are unique. That is it goes through the HSCRC. They set the rates. So that is the answer for that. All payers pay the same.
Yeah, but this is the fee, not the rate, so, thank you.
Yeah, but she was talking about the rates. Yeah, thank you. Delegate Hill.
Thank you. And maybe you can't answer this, but I thought that we set the rate, but Medicaid, Medicare determine what they're going to pay regardless of our rate. And if we set the rate here and they decide we're only paying here, we have to eat that. Do you know if that's true, unlike the other providers who they'll pay the rate? But Medicaid, it's like our prescription drug affordability. Medicaid says this is all we're going to pay. You can charge whatever you want, but this is what we're going to pay. Is that somehow different?
Are you asking about the physician evaluation and management fees?
Talking about any fees that we set, hospital fees or anything.
I believe
We can
Medicaid
bill
pays,
them.
I'm sorry.
I'm sorry, we bill them, but that doesn't make them pay the rate that we bill them. Is that inaccurate?
I believe it would be included in regulated rates by the HSCRC, but I will follow up on that to clarify.
And if I may, they pay what the HSCRC sets. It doesn't matter who you are. Maryland is the only state in the nation, and others will follow, right, with your head model. But it's the same for the hospitals. You're welcome. Delegate Bandari.
Thank you, Madam Chair. I know you answer a lot of questions regarding DDA budget shortfall. I have a quick question. Given the ongoing workforce shortages and rising operational cost, how do we justify that these reductions are without compromising the quality of care for individual? That's number one. And additionally, can you provide a breakdown how this cost will be observed? Will it result in reduced ways for direct support professionals or fewer services or shift of costs onto families? If the goal is cost containment, what safeguards are in place to ensure that our state remains competitive in attracting and retaining a qualified workforce in this critical sector?
Those are great questions. I can maybe, what can I tell you? It's really a question for the health department. I mean, in terms of how the money is budgeted and allocated and what they're deciding to invest in workforce development is, we can't really speak to that. And I wish I had a better answer for you.
If you don't have it, it's okay. As I said
That's all I
earlier, you're doing a great job. You're presenting the numbers as they are. You don't have the answers to how all this stuff works, right? That's why we have the secretaries and other people, and we can seek that information offline, okay? We can do that. Thank you. Any other questions? All right, I want to thank you for being here and for taking these questions, okay? And for your patience and your grace. You have a great afternoon.
You too, thank you.
Our pleasure. So for the committee, please don't go anywhere. We're going to go right into bill hearings so that I can get you out of here, just so that you know, we have 10 bill hearings. So let's just stay here for a second, and then we're going to go up right, and I'll tell you the order and how I came about with the order. Will you take us down?